COVID-19, vaccines, and kids. It's a complicated time for parents with lots of decisions to make.
As the U.S. rolls out vaccines for kids, we're cutting through confusion and getting straight to the facts.
You have questions. We're going to the experts for answers.
This is Verify Kids and COVID-19, a KVUE special presentation.
Thanks for watching, everybody. I'm Quita Culpepper.
And I'm Brian Mays. Over the last week, we've asked you to send us your questions about COVID-19 and vaccines for kids. It's time now to take those questions to the experts.
Now, we are joined by 3 doctors from the Austin area to help answer those questions. Dr. Ronald Dixon is a medical physician and CEO of Care Hive. And Dr. Jamie Avila is a pediatrician with Baylor, Scott & White. Dr. Natasha Kathuria is an ER physician and global health specialist. And thank you all for being here with us. We appreciate it.
Let's get right to it. Our first question is for Dr. Avila, and then the other doctors, if you have something you'd like to contribute, like a conversation, we'd like you to weigh in as well. Let's start with this. A 5-year-old can be significantly smaller than an 11-year-old. How do they come up with a proper dose that will be effective for both the smaller child and the larger child?
Well, so whenever these studies are set up, an important part of the phase 2, actually, once you make it past phase 1 where there's no significant side effects that are noted, you actually expand to a much wider group of kiddos. And so what they focus on is getting not only various ages, but various ethnicities, various comorbidities. And so those sort of things and monitoring them help us to establish where the vaccine doses come from. And so really when the one that's approved right now, the Pfizer, was done, what they did was they actually looked at multiple dosages. And so they administer it and then they follow it up and they see what is an effective dose for all of these kids that were put into the study that achieved a significant amount of antibodies and the least amount of side effects. And so what they noticed from the 5 to 11 group is that the smallest amount that they tried that gave us a significant effect, but the least amount of side effects was the 1/3 of the adult dose, which was the 10 micrograms. And so really it's having that wide variety in the study that allows us to see, okay, you can give it to a 5 or a 10 or an 11-year-old of various sizes and still get a significant response to it.
Okay, well, we do have a question from Priscilla in San Marcos. She says, pharmacists know which dose a child is getting. How do parents know the child is getting the correct dose or from the correct container? Dr. Kathuria.
I think the most important thing there is to ask. That's when it's really important for the parents to ask and verify, just to be sure. I mean, the pharmacists, they have a very strict checks and balances system in place. They're not just pulling a vial and giving multiple people, and there's lots of documentation that goes into every single dose that's given out to every person, no matter what age. So if a parent is worried about that and wants to know, hey, is my kid getting the 5 to 11 dose or the 12 and over dose or the adult dose, just ask the pharmacist and make sure they verbalize it back to you, just so you have that sense of reassurance before you get it. And quickly going back to the question about the different dosages and how they decide on that, I think it's also really important for parents to understand that medications and vaccines are different. When we look at medications, we look a lot at weight-based dosing. And that's because they're metabolized differently through the liver, through the kidney, and we need to make sure that that dose is by the weight of the child. Some things are done by weight, some things are dosed by weight and height, but for vaccines, it's based on your immune response. And that's a time thing that develops over your time of life. So it's by birth date and age, not by weight, not by height. So it doesn't matter if you have a really big burly kid or a really tiny, premature who grew up maybe a little bit small. That doesn't matter. What we really look at is age, and that's why there's a little bit less confusion, I think, for parents if they understand that.
Well, that's something I never really realized.
And just piggybacking off the viewer's question, the idea of asking a professional, that's also something that we really want to get out there. Talk to your pharmacist, talk to your doctor, talk to your nurse, talk to a trusted healthcare provider if you have questions about the vaccine, because that's going to give you the accurate source of information and reassure you. And we'll continue to ask questions as long as you have them.
Good deal. And don't be afraid to ask those questions.
It's good advice for sure. All right, can children expect the same kind of side effects from the vaccine as adults experienced? I know some people really didn't have any reaction. Some people really suffered a lot with a fever, maybe aches and pains. Dr. Dixon, can kids kind of expect the same kinds of side effects?
Yeah, the simple answer is yes. Just like any other vaccination for flu or the COVID vaccine, you're going to get the local reactions, pain in the arm. You can get systemic reactions like fever, chills. Some people get nauseated. Some people get muscle pain. All of those things can be experienced by children, teens, adults, and older folks. The good thing is those symptoms are far less than the actual disease. So the reason we give the vaccine is to prevent disease, and this vaccine is very effective at doing that.
Dr. Avila, is there a point as a parent, I know, say it's your first child, they're just 5, they get really sick, feeling sick, feverish, aches and pains. Is there a point where you should call your doctor if there's a reaction to that vaccine?
Well, we always tell our parents, you know your children better than anybody, right? And so I really tell them to listen to those gut feelings. There is never a dumb question when it comes to follow-up. And so I say, if you reach the point where you're uncomfortable, contact us, because we're happy to either see them. We have telehealth options now. We can take a look at them. But the biggest thing that we really want families to know is that those symptoms that you're experiencing after the vaccination is really your body's response, that it's the inflammatory response showing, yes, you are building the immunity to it. You are not experiencing symptoms of COVID. It may look similar, right? And so the fever, the chills, but this is something, like Dr. Dixon said, significantly lower. It's going to last a couple of days, and it's not going to have the same sort of secondary effects that contracting COVID is going to. Okay. And so, yeah, we encourage them to just speak up and ask us. Absolutely.
So basically, it's just a roll of the dice. You could have 2 children in the same family, both get their shots. One could have severe symptoms, the other could be just fine.
Absolutely. And we actually saw in the study that was done that the 5 to 11-year-olds did have significantly lower secondary effects, but we also think that it's because they received a smaller dose.
Makes sense. All right, we've got another viewer question. This is from Mel in Austin. Here's the question. Is there a chance of blood clots with the vaccine for kids? I know there were some issues with the Johnson & Johnson vaccine in adults several months ago. Have you seen anything through the trial or through the initial phasing in, Dr. Avila, of blood clots with kids?
No, not at all. And actually, I specifically had a conversation with the head of our hematology department yesterday, inquiring about the Pfizer vaccine for children with known clotting disorders. And because I hadn't seen any studies to suggest it, and they said absolutely no contraindication because there has not been a correlation at all.
All right. Would either one of you like to jump in on that?
I completely concur.
Yeah, and I think even with adults, it's important to really understand the risk, not just for children, but even if we're thinking about the parents getting the vaccines or older children, there's this fear of, there's a risk of blood clots. That risk is so minimal. It's 66 out of 10 million. So that is such a low risk of blood clots versus pregnancy, for example, which is, a much higher risk. Pregnancy alone is 2 in every 1,000.
Wow.
Birth control is 1 in every 3,000. So 66 out of 10 million. For an adult, it's just comparing that risk and really managing our fears that's really important. Versus COVID, 1 in 5 hospitalized patients with COVID have blood clots.
1 in 5?
1 in 5. So,
wow.
And that's hospitalized, so not just those who are symptomatic, but those who actually get hospitalized and get sick. So the risk is significantly higher with COVID-19 than the vaccine. So that's why we really don't want anyone to feel discouraged with that minimal risk.
Well, this question also from Mel in Austin. She asks, is there any chance of death with the vaccine? Dr. Kathuria.
Well, I like to, make it very simple. There's a risk of death with anything. There's a risk of death with me sitting here right now. So there is always a risk of death with the vaccine. What's really important is understanding the information that's out there. When we see, if we just look at all the reported deaths that go through VAERS that haven't been verified, people will be very overwhelmed by that number that they see. But what's actually been verified and actually linked to the vaccine is 3 deaths. So it's not something that, that's out of 200 million people who've been, almost 200 million people in America that have been fully vaccinated. So that's, pretty negligible risk that wouldn't even be statistically significant for us to consider at this point.
And those deaths were adults.
Those were adults, yes, because we have not seen any in children or any in, these are adult deaths that have been linked to the vaccine.
Okay. You mentioned VAERS. That's something before this I had never even heard of. Dr. Dixon, is that a point of disinformation you feel? A lot of people point to those numbers of adverse reactions and use that as a basis to kind of say, see, this is bad. Whereas in reality, if you look at the total numbers, it seems to be a benefit to have that information. Is that correct?
No, you're absolutely correct. I think it's, math is always challenging when you're trying to present it to patients. So that one story, those 3 deaths, people will say, well, I heard that it was somebody that was just around the corner. And that's just enough to scare a lot of folks away from a vaccine. So the way that we relate statistics to patients, we have to be very careful about it. And we really have to do our job at explaining. I think that was a beautiful job. It's 3 out of many million. That is a very, very, very low risk. It's way worse a risk of me, coming to the clinic and crossing the street and getting hit by a car. Far higher, right? By multiple times. And I think we have to, when we're talking to patients about risk, we have to be very clear, because that's really what's confounding it. This idea that, oh, well, I've heard, and that makes folks fearful.
Sure, and it's understandable when you don't know enough about it. We don't know half, a small amount of what you all know about it, but you hear the concerns, and that makes you start thinking about maybe there is something negative, which brings us to our next question. Myocarditis, another term, medical condition I really didn't know much about until this vaccine, until this disease. Is the chance for myocarditis greater once you get the vaccine? Dr. Avila, I'll take this one to you.
In comparison to getting COVID-19, absolutely not, because we know the risk is very real of getting myocarditis with COVID-19. There was a temporal relationship to a group of mostly adolescent young adult males who, after their second dose, within a couple of weeks had it. But again, the numbers that we're talking about are less than what you would expect in the general population to just contract myocarditis. So we really can't say that that temporal relationship to their vaccine means that it was a causal relationship. And so I think that's really important, because what we have really seen, and one thing that the American Academy of Pediatrics has really pushed on, is that when kids contract COVID-19, regardless of the severity and how many symptoms they actually are expressing, a significant amount of them are actually have heart inflammation, and that's been a big thing that we've actually focused on when we're following up on kids prior to return to sports and that sort of thing, because a lot of parents think, oh, he had a day of fever, he had some cough, but when you start to delve into, you realize that there really are some lingering effects, and the numbers of those have been so much more significant than I think most of the general population realizes. And not to mention, we have had 0 hospitalizations related to the myocarditis thought to be from vaccines. We have no hospitalizations from vaccine effects, and we have a significant number of hospitalizations from the COVID-19 effects.
And that was actually a question I had gotten from a parent. They were worried about letting their teenage son get the vaccine because he's an athlete. Of course, heart works a lot. She didn't want him to have a chance to get pericarditis, myocarditis, anything like that. So this is something that parents of athletic children don't need to worry about or don't need to stress too much about.
Right, and I would argue that the athletes too are at a higher risk, not for the myocarditis, but just in general for COVID-19, because we've seen they're in group sports, they're interacting in larger groups, and so we've seen whole teams contracting COVID-19 when one comes in not realizing that their symptoms were COVID. And so I think our athletes are some of the largest population we should be focusing on.
Interesting.
Well, are you comfortable with the testing and procedures that have taken place to get to this point with the vaccine for children? Dr. Dixon, I want to give you that question.
Yeah, I mean, absolutely. So again, the vaccine was tested in a clinical trial. and was proven to be effective at the dose that we're currently giving it to. We know, as was said, that the side effects of the vaccine, so the likelihood of getting myocarditis is extremely small compared to the likelihood of getting myocarditis if you get COVID. The likelihood of ending up in the hospital with a vaccine-related problem is very, very infinitesimally low compared to ending up in a hospital if you get COVID. So all of these studies, all of these results suggest the likelihood of getting a vaccine leads to less likelihood of hospitalization, which is what we want from a population perspective. So absolutely very satisfied with the studies that have been done.
Would you all be comfortable, I'll start with you, Dr. Kathuria. This is just a generic question from a viewer. Would you be comfortable personally having your children 5 to 11 vaccinated?
Absolutely. I don't have children yet. I've got one brewing, and I'm about to get my booster. So essentially, I feel like I'm going to give my child those antibodies as if I'm vaccinating my child. As soon as my child reaches the age that they're available for any of the vaccines that we have, I will absolutely vaccinate my child. You know, as a physician, I'm sure the three of us all feel the same. You know, we see what happens when people don't get vaccinated. Mm-hmm. We see the worst of every situation, and from someone who's seen that, especially through COVID, and seen how it can just ravage the body of anyone of any age, I would never want even 1% of that to affect my child, or my parent, or my husband, or my friends, or anyone, and any of you. And that's why I think this is just a really important conversation to keep having with each other, because for those who don't see it, when it doesn't hit home, it doesn't hit home. And you don't want that to come into your home. It's like lighting a match in your home, and it can set your entire house on fire. And so, you know, we see that happen in the ICUs that are just filled with people suffering, and their entire families are then suffering. So I would absolutely vaccinate my child if I had a 5-year-old.
Dr. Avila?
My oldest is vaccinated. He was the only one that was old enough up until this past week, and my younger two are getting theirs tonight.
Oh, nice.
So, without a doubt, yes.
Dr. Dixon.
Absolutely, no doubt. I've got a 10-year-old at home getting vaccinated, and I think you know, this idea of statistics is so important. I bet you that your viewers know somebody who had COVID, know of people who have had very bad outcomes from COVID, and they're going to be hard pressed to find somebody who's had a bad outcome from vaccination. So I think when you think of relationships and the risk of knowing someone who's had some sort of an adverse event from either a vaccine or from the disease, it's very much more likely that you know someone who's had a bad outcome as a result of the disease.
Let me follow up on that, Dr. Kathuria. This brought something to my attention. You see the stats of people in the hospital, kids in the hospital. Why do you feel like people focus more on the vaccine as a negative as opposed to the virus?
Well, I think just like anything else, like with politics, with anything that we want in life, if you want a certain type of car, you're going to want to hear information that supports that type of car you're looking at. It's the same thing with vaccines. If somebody is naturally more vaccine hesitant, they're going to lean towards any information that supports their narrative. And we see that in everything, not just with vaccines. And so if someone, you know, like for me, I'm clearly biased, I'm a physician, you know, I'm very science driven. So I'm going to naturally look at information that supports, you know, the COVID-19 and not the vaccine in terms of negative side effects. But what it's really important to know is that when we look at politicization of this vaccine, for example, that's been critical. That's really affected our ability to vaccinate, you know, especially in a state like Texas. It's a very politically divisive topic. And what's really important to know is, I always tell this to my patients, there's no political unity among physicians. There are lots of conservatives, very conservatives. There are lots of very liberals. We are not like politically united in any way. But when it comes to the vaccine, and those who are treating COVID patients, who are you know, seeing this, learning about immunology, we know everything about immunology, vaccines, you know, COVID-19, there's no hesitancy. It doesn't matter where you are in the political spectrum. There's just none. We have almost complete vaccine compliance with all of our physicians. And I think that that's very reassuring, is when you want to know the information to make the best decision for your loved one, you want to go to the people who are seeing it, treating it, know the most information about it, and least likely to be biased. And to me, I mean, we're the ones seeing it and treating it and studying this all the time, conducting these trials, reviewing the research and the data. And we're not politically on any spectrum, and we're still 100% in agreement on this. It's unanimous amongst us.
I would say that from the eyes of the patient, it has been pretty quick. When I would see patients in my office and talk about flu shots, for example, often they'd be like, "No thanks, doc, no. And then the next year, no thanks." But as I continued to talk to them and the relationship grew, eventually they'd be like, "Okay, I think I trust this person, and if they're giving me the advice that the flu shot is a good idea, then I'm going to do it." And what we've had the challenge of is no time, right? This virus came and it was on us, and we came up with a therapy pretty quickly and a vaccine very quickly. And it hasn't given time for people to just trust it. And there hasn't necessarily been time to build trust with the providers who are going to be delivering it, because it just happened so fast. I do think that over time, through conversations and relationships with trusted healthcare advisors, providers, navigators, that you will see vaccine hesitancy decrease. It's, the pandemic has created a lot of fear and anxiety in people, and I think that feeds some of this suspicion. And suspicion can only be overcome through conversation, relationships, and time. And as we have more time, I think you'll see some of the noise going away.
Now you talk about people having trust in the vaccine and in science. That sort of leads into this next question from Jay here in Austin. He asks, why is an experimental vaccine being pushed on our children when they have literally zero chance of getting the virus? Now let's just break this question down first of all. Experimental vaccine. Who wants to take that one?
No one.
No one wants to take that.
No one wants to take that one.
I think that's pretty humorous to hear. It's the furthest thing from an experimental vaccine.
Yeah.
It's gone through so many iterations of clinical trials. It's been so much time by now. We've had hundreds of millions of people get this vaccine and be fully immunized. Worldwide, not just in America. And, there's no experimenting going on. So I think that is just, appealing to emotions, I think, in people. A little bit of fear-inducing that's not substantiated at all, versus food we eat every day that doesn't go through clinical trials, and other things, supplements that, people will willingly take because they're not having this induced fear. And it's not an experimental vaccine by any means. There's no other way to say that.
Please.
I think maybe where the person is coming from is the technology that was developed to create the most popular vaccines, Pfizer and Moderna. The mRNA technologies was somewhat new. So it could be seen to the public as, well, this is, it's not the usual it's a viral vector. This is different than what we're usually seeing. That could possibly allow people to think of it as experimental. The good thing about it is, as was just said, it's been tested over and over. It was tested in clinical trials, and now it's being really tested in all of us around the table. And if the results are effective in all of us around the table in the clinical trials, we wouldn't deem it as experimental.
And I know the second part of that question said there is literally zero chance of a child. I'm looking at the look on your face, Dr. Dixon. There's literally zero chance of a child contracting COVID-19.
No.
I think that maybe in y'all's personal opinions and in your work life, you've seen that is not particularly the case.
I would say that the 6.5 million children that have contracted it already are probably offended. That's in the US. So that's clearly a false statement. also, so we have 6.5 million approximately, and that's from what has been reported, that have contracted it in the U.S. And I also don't think that the over 600 deaths we've had are insignificant either. So I would say that as a person who literally treats children with COVID on a daily basis, it's hard for me to swallow that portion of the question, because it's here, it's real, it's affecting our children, not just the disease when they catch it, but the long-term effects that even the children are seeing with these long COVID and having the parts of their system that are ongoing effects. I still have children who contracted at the very beginning of when we knew there was a pandemic that have symptoms that we're trying to control. And so it's real on a psychological basis for them, physical, emotional, and so yes, I disagree with that very much so.
You mentioned over 6 million kids have been diagnosed with this. No telling how many were never tested, didn't know they had it, or had it and passed it on. Should a child that has had COVID be vaccinated? How important is it for that person that has been infected, that young child, to still get the vaccine?
Yeah, absolutely. Like 100% without question, they should still get the vaccine. What we've seen, a lot of people are saying that they are okay with the natural immunity. But what we've even seen in the adults is that not everybody that contracts it is forming what we call IgG, which is the immunoglobulin that like gives you your memory. And so it's interesting because not everybody that has the natural one creates enough immunity to prevent it. And also, when the vaccines that are available to the 5 to 11 particularly were created, it was very specific in the way that they targeted this, right, with the S protein, the spike protein. And so this is unique in that as variants come along, that's one of the few parts that shows itself to our body, right, and has less of a chance of having variation between all of these variants. And so you're also protecting yourself as these other variants move in, which inevitably, you know, there will be more as it goes around the world time after time. And so, yes, without hesitation, I would say that you should get it. And we've seen the immunity that's generated by the vaccines tends to be better than the natural immunity. So, absolutely.
Well, we know that boosters are being given out to adults right now, but do we have any information about whether or not children will have to get the COVID boosters as well?
I'll tell you that are immunocompromised in the 12 to 18. A fair number of them that are past the 8-month mark have already been offered the boosters. They're at a little bit of a higher risk. So some of our targeted population are getting them already, and it's been generated by their specialists. So like our cancer patients, our kiddos that have gone through transplant. And so of course we don't know for sure, right? Because the trials for the younger ones aren't as far along. So we don't know when immunity is going to wane. And what we've seen so far in the adults is that the immunity from the vaccines really is having a very nice length to it. And so I would say, truthfully, just from what I know about vaccines, I think there eventually will be a booster, but it's going to take us time to figure out like how far out from that initial injection that's going to be needed. And it's going to vary from person to person. There are going to be people who are at a higher risk, just like right now there's specific, you know, people that meet criteria for the boosters. I think it'll be the same for children. We just don't know what that point will be.
This next question is from a viewer. It's a video submission from Robert Price here in Austin, and this question is for all of the doctors.
I recently received the Moderna booster shot, and my question is, have there been any reports of people who have already had their booster shots having breakthrough cases and getting the infection? I'm hoping there haven't been, but I have been curious. Thank you.
Dr. Kathuri, you want to take that one?
You know, there is risk to get a breakthrough infection even after the booster vaccine. There's risk of getting a breakthrough infection after the first dose, the second dose, booster vaccine, but every dose you get exponentially decreases that risk, exponentially. So if you have, you know, go from 1 dose to 2 doses, for example, you're significantly less likely to get COVID. And if you get that booster vaccine, again, exponentially lower risk. You know, the information that we have right now and the numbers that we have right now are small. We just started boosting people. Granted, people were unofficially, we had millions of people unofficially get boosters just by, you know, going to pharmacies and asking for a shot and, you know, getting them, you know, unofficially, and we have seen some breakthrough infections, very rare, and they're usually very, asymptomatic or minimally symptomatic. I can tell you personally, I have not clinically seen a single one come into the ER. I work at several ERs in 3 different cities, and I've not seen anyone who's been boosted have COVID, need to be hospitalized for COVID. Granted, I'm only seeing ER patients, but I think the risk is just lower. I don't think we can say, even if say we had 0 people who had been boosted get COVID, that's not an accurate number. We just started boosting people. So we're going to anticipate that we are going to see breakthrough infections, just like other countries that have been boosting have, but at a much lower rate.
All right, good deal. Well, this next question is for Dr. Dixon, and actually I'd love for both of you as well to jump in on this. There are patients who don't want the COVID-19 vaccine for various reasons, and I know you've spoken with your patients about this. How do those conversations usually go?
Well, generally, there's a reason why people don't want the vaccine. Normally, there's a concern about things like, I've heard fertility as being a big one, which has been debunked. Like, there's no evidence that it can affect your fertility if you get the vaccine, but there's a myth out there. There's also the concern that if you get the vaccine, you might get COVID. I've heard that from patients, that it's actually going to be worse than actually getting COVID. And all we can do is reassure and give them the facts that, yes, there are side effects of the vaccine, but the side effects are far less than the disease itself, and the ramifications of getting the disease can lead to hospitalization, ICU, intubation, whereas if you get the vaccine, that becomes very less likely.
The argument I hear when I bring that up to people about fertility, and I've had friends tell me this, if my daughter's 16, how do we know what she's going to experience when she's 32? What do you tell a patient that asks that question about fertility in relation to the vaccine?
Oh, I usually point to my vaccine. Well, I'm fully vaccinated, and I clearly.
That's why I asked you.
Yeah, I mean, looking at the science and how that myth even became a myth is a little bit frustrating. There's no evidence. Like, it's not even a possible thing that could happen. Versus with COVID, we've seen some traces of evidence that COVID could maybe potentially affect male sperm quality. That has not been something that we've, really put out there, something men should really fear. But there's been something that I could see how that would lead to some fear, but not with the vaccine. Mm-hmm. There is no possible causation there. So it's just not, and we've had countless studies now from the American College of Gynecology showing, fertility rates have been the same. They've not been affected. Even patients who are not infertile, but have fertility issues, who are going through IVF treatments, meeting with a reproductive endocrinologist, no effect. They're not even cautioning their patients with getting the vaccine because they know it's not affecting your ability to conceive. And, we haven't historically ever seen vaccines cause significant side effects after a few months. So this theoretical concern of what if 5 or 10 or 20 years from now or 30 or 50 years from now, we've never in history seen that. So there's no inkling in us to suddenly fear that now with this vaccine.
And I know a lot of people actually who are pregnant who still have that worry. They don't want to get vaccinated because they don't know what it's going to mean for their unborn child.
Right, and that is actually a really important point to bring up, especially with the Delta variant. I personally, and I'm sure all of us have seen, so many more pregnant women this time around than non-pregnant patients, than with the prior strains, get critically ill from COVID. I had never seen that with any of our prior surges in Texas, and with this surge, it's been devastating. And as a pregnant woman treating these patients, really heartbreaking to know that, up until recently, we only had, I think, about 23% of pregnant women vaccinated. That's an appalling number for a high-risk group. And it's not just to protect baby, it's to protect mom. It's 2 patients that one vaccine is going to save the life of. And there is a fear, of course, every pregnant woman, even myself going through pregnancy, you want to do everything right. There's this fear you kind of overanalyze everything. But at the end of the day, it's really important to just be as objective as possible and really weigh the risks. And the risks of COVID could mean death to mom, death to baby, or a critically ill mother, or a baby that's born premature in the ICU just hanging on. You know, you're dealing with a lifetime of complications that you never had to worry about if you were vaccinated. We're not seeing that with the vaccine, not in one single pregnant female.
Again, we're running short on time, so I do appreciate you all's time. I'd like to go through some rapid fire questions. If the answer is no, you can just say no. If there's something that's obscene about it, please point that out. These are some things we've seen or received here at KVUE from different people or from the internet. We all know how popular the internet is. All right, let's start with you, Dr. Avila. This statement, the mRNA vaccine was rushed.
So I think it's important to point out that mRNA vaccines and this technology has been in the works for decades, literally decades. And it came to the forefront when this vaccine was completed, but we've utilized this technology in cancer treatment. We were looking at it before for things like CMV, influenza, Ebola. So this is not new technology. The fact that we were able to accomplish completing the technology is like, I just applaud everybody's efforts on that because it's phenomenal, but I would not consider this rushed at all.
All right, and I know we've touched on this a little bit, but the COVID-19 vaccine causes heart issues.
False.
There it is. Does not count.
Rapid fire.
Again, we'll need a booster shot every year. I think the consensus is we don't really know yet, do we?
Correct. We don't know. It depends on the level of herd immunity we get to, what variants come out. I think we can assume that that's very much on the table, but it's not something that we think yet.
There will be another variant that will just evade the vaccine. The vaccine won't even be able to touch it.
Highly unlikely. I mean, anything is possible, but highly unlikely given the way the vaccines are developed against the spike protein.
Right.
One of my favorites. There's a tracking device that when they put this in my 5-year-old, they will know exactly where that 5-year-old is at all times. There is no tracking.
False. No.
But the real question is, who is they?
And why do they want to know where my 5-year-old is all day long? I think that's the last rapid fire. I saved that one for last.
Thank you.
Yeah.
Well, this last and final question is for all of you, but Dr. Dixon, we'll start with you. What has the healthcare industry actually learned from this pandemic, and what can be addressed going forward?
So I might be a bit biased, but I think the industry's learned that there are different ways you can approach delivering healthcare. Number one learning is, clinics closed, hospitals were overfilled, and especially patients with chronic disease, they couldn't get access to care. They turned to telehealth and digital engagement to get their healthcare, and that was extremely successful. You saw 25 to 75-fold increases in the utilization of telehealth. There's still a disparity in rural versus urban, in that rural access to telehealth still is slow. But that was the big learning, that COVID really pushed this idea of digital access to a clinician to a new level. And I think as we go forward, we have to embrace that learning and make that aspect of delivering care far more easy and more common, especially for patients with chronic disease, because they were the ones who bore the brunt of the worst outcomes in COVID. Diabetes, for example, far worse outcomes. So why don't we start thinking about delivering care to diabetic patients in a way that utilizes these types of access modalities.
Good deal.
Yeah, I completely agree with that. I'll piggyback off that last comment as well. I think one thing we've learned as physicians, which we knew, but now it's been really driven home, is the importance of healthcare in terms of nutrition and chronic disease management, and how that affects patients in a way that's not just their diabetes or their heart disease, but how, we already know this with influenza, that you're significantly increased risk of having a heart attack in the 6 weeks after having the flu if you're unvaccinated. And we're seeing that exponentially higher with COVID. And so to really drive home this importance of good nutrition, healthy habits, and as a global health specialist, I have to just say this, but I think one thing we're still learning with COVID is the importance of global, healthcare. Right now it's global vaccine equity. We can't just focus on Texas, America, Austin, we have to focus on the world, obviously in different avenues, but really controlling this on a bigger scale. And then I think the final thing that we really learned, again, biased from the ER, is PPE resources, having this stocked up, being able to really pull a trigger and have tons of PPE available to protect our staff and overprotect rather than underprotect moving forward.
As a pediatrician, are there positives you can take from what we've learned over the last 20 months?
Yeah, absolutely. Honestly, the things that have been mentioned so far have been huge for us. We went from really zero telehealth to now it's an important part. We're in local school districts providing care on the point. Also very important is, like we said, having the PPE. We've learned that our resources, they do have a limit. And so we have gotten very good at utilizing our resources, which is not only like the personal protection equipment, but our space, our staffing. And so I think this also better prepares us, heaven forbid another, this one's not over, but another one comes along, and you can transfer that too to, when we have local disasters. Anytime something huge happens and you need a lot of resources quickly, I think we now have a better feel for how to mobilize people to support. And I also think one of the big things that I've seen working on more of the administrative side is just how important it is to support our healthcare workers, because they have really become exhausted over these past couple of years. And so supporting them and their mental health and their physical well-being and all of that is so important too, to keep them in a healthy place where they can continue to provide care to the people who need it.
Well said.
Very well said. And we are going to wrap things up. Thank you so much for being with us, Dr. Ronald Dixon, Dr. Natasha Kathuria, Dr. Jamie Avila. Thank you all so much again for being here and just for sharing your wisdom with us and with our audience.
Thank you for having us.
It's been a great conversation. If you'd like something you'd like to see us verify, just text us. The number's 512-459-9442.
Our Verify team is hard at work sorting through misinformation that's spreading online, and you can see all of our stories on KVUE.com/verify. Thanks for watching.